Oh, good morning, good afternoon, and good evening for everyone. I hope that you can hear me clearly. So thank you so much for the invite to participate in this session today. So I will present briefly what it is, the X-eHealth or Cross-eHealth. That is an European funded project by the European Commission about the exchanging of the electronic health records in a common framework. So in terms of the background, sorry about it. Just one. In terms of the introduction of the project, there is three main pillars that are very important to keep in mind when we talk about this sharing of health data across border. The Cross Health project intends to contribute on the digital single market strategy and the sharing of health information between the different member states across the European Union, and really implement a common sectorial approach in a common format of exchanging health data in really to increase a better access in terms of the consumers and business to business in online goods and of course digital healthcare services. This will lay down the foundation for three pillars that are very important for the strategy of the European Commission about the digital single market. It is the citizens secure access their health data across border. So it is how can I access the health data everywhere when I am the European Union, to have a personalized medicine and individual planned care when I am in EU, and of course to have the citizen empowerment and the use of digital tools in order to have a preventive treatment for the European citizens. So this is the three main expected pillars that we strive in this project. In terms of the relevant trends, in these upcoming years, we see in a lot of the different markets that artificial intelligence, virtual reality, and the cloud computing and the use of big data are the important assets and are important drivers on how can we make the most of the healthcare data. But if we look on the healthcare market trends, we see as well very important uptakes and messages that we are going to strive in the next upcoming years, and they will be very important for these topics. It will be the precision medicines and genomics. It will be the internet of medical things. It is how can I have medical devices and medical equipment in my home. How can I have the best care delivery in a remote patient care, and of course the use of telehealth? And we do believe that this type of trends will really foster the individual planned care of each individual across the globe. So in terms of the mainstreaming of these initiatives at the European level, we are going from a path, from a road, from a personalized medicine that will ensure the privacy and the security of the health data in order to be used by each individually by using the portability of health data to have the data, for example, in the smartphones or to be accessible by the different healthcare professionals. Although it will be important that this type of information will be accessible by not only by the healthcare professionals, but the citizens, the different healthcare organizations, and the policymakers. Two important aspects that are very important when we do this cross-border collaboration between the EU countries. It is the exchange of this data at the national, EU, and international scene. One of these examples, it is the creation of the International Patient Summary. It is a common data set to share some data in the urgent cases. And of course, really the driver at this stage, it will be how can we make the most of the data that we have in our organizations, in our countries, in our institutions for secondary purposes. Really the uptake here, it is really said in some previous sessions, it is this three helix: the industry, the healthcare institutions and the research. It is very important that we start working as a common ecosystem. And for that, the project really aims down to lay down the foundations on how can we advance the integration of the e-health or digital health services in the different European countries. And for that, it is very important to ensure four main goals. The the data needs to be in higher quality and to promote the safety of the treatment of the citizen in every country around the EU. And for that, it is important to allow the citizen to access and to manage the electronic health records, to contribute to a standardization and harmonization of digital health services in have different agreements on the levels of interoperability, to contribute to the defragmentation of European services, and of course, the most important that I do believe it is the interaction between the patients and the healthcare professionals and the healthcare providers. It is very important to have an important role on prevention and empowerment of the citizen. Any other way around, it is very important that the professionals have the right data and quality data on their disposal to treat the patient. With that, we do have some specific objectives and really to promote the safety and the quality. So this is for you to understand that what I reported back to you previously, it was in these three domains. So what we want to ensure as an impact, there are four impacts that we see that are very important as a project and we would like, let's say, to have. It is to ensure the accessibility and the portability of health data across citizen, researchers, healthcare services, and health professionals. How can we enhance and increase the digital literacy of the different professionals and citizens? And of course, how can we integrate the health data into the health ecosystem in order to have a tailoring digital service infrastructure on demand for the different healthcare providers. In the end, what it is our main objective, it will be to have a better and easier access to online tools and applications and digital tools for a safe healthcare delivery. So the project will aim to set down a set of specifications and implementation guides on how can we share these four domains across the EU. Lab results, a subset on the rare diseases, medical images, and discharge letter. In terms of conclusion, what we really think that in this collaborative spirit between EU and China, it is very important to bring a strong community outside of the EU, that joint cases to build a global community of innovation to make a better use of novel technologies such as AI. It is a very important uptake for the next future. It is very important that we start from a collaborative work to promote the use of common models, standards, and ICT tools in order to build a strong community that contributes to the defragmentation of the national and cross-border digital health services, and to really to share experience on what works and what doesn't, and perhaps set up a joint case study. This is something that it is really important in terms of how can we make use of the data, how can we make use of common data and common standards in order to really to increment. So the three main messages that I want for you to let back at home, it is that we need to jointly work on a standardization and harmonization, computer literacy and digital inclusion, to furnish our citizen and healthcare professionals with the required e-skills and digital competence in order to enhance the medical response to the urgent and planned care with the high quality data. What the project aims, it is really to set down the set of specifications and implementation guide on how can we implement common models, standards for the sharing of the domains on lab results, images, discharge letters, and rare diseases. So in conclusion, you can follow our project for the next 2 years, that it is composed by 34 partners among the 22 member states of the EU, with almost 100 people collaborating on it. You can always follow on our social media, on Twitter, on LinkedIn, and of course, if you have any question, you can always drop me an email to my professional mailing box, or in the social media, in the Twitter. I hope that you can enjoy. If you have any questions, I will answer in the end. Thank you so much.